We are back on Taking Care of Business on Current Radio, News Talk 1180. Our guest by phone is Sally Pipes, the author of The Truth About Obamacare.
And the Pipes Plan.
Yes.
10 ways to destroy, get rid of Obamacare.
Both
10
excellent
ways
books.
to dismantle and replace.
Yeah, well,
there you go. Both excellent books. Highly recommend them both.
Sally, one of the things I wanted to just touch on a little bit is all of these charges and fees that people are going to have to pay if they don't buy the insurance, and then the new taxes that they're going to be imposing on employers if they don't supply insurance, and how the exchanges will work maybe a little bit, as well as funding. So if you can touch on some of those items.
Well, in the Affordable Care Act, there are a lot of things. I have about 15 what I call pillars of Obamacare, 15 main pillars. One of the issues that has not been touched on a lot, and when I tell people about it, they're absolutely astounded, and that is the new taxes on Medicare. The Medicare payroll tax, starting next year, 2013, is going to increase by 0.9% to 2.35%. From where it is now at 1.8. And then the other issue is this new Medicare tax on unearned income. Both of these taxes will be implemented in 2013 on individuals with earnings of $200,000 a year, couples at $250,000. This 3.8% tax, which goes into effect next year, is going to be a tax on unearned income, including interest, dividends, cap gains, rental properties that you may have, the difference on the exemption on the sale of your primary home. This is a huge new tax, and people just are not aware of it. And we have to let more and more people know that this is in the works for 2013.
Now, Sally, this is the same capital gains that Obama's trying to get now taxed at 30% to make it equal. On top of that, we're going to have a Medicare tax on those same capital gains?
Yes, absolutely. And so, he's really trying to, I think, destroy our society because, he says the rich are just not paying enough and the burden is all on the middle class. Well, we know from past history, the more we tax the people that create the jobs and make this economy hum, the more we're going to see a complete turn down in entrepreneurship and new job creation. And certainly the president has been in power since January 2009, and the economy, because of, I think, one of the main reasons the economy has not bounced back is because of Obamacare. And we've certainly seen in the surveys of people who own small businesses, they haven't been able to qualify for these tax credits that, the administration said there will be, up to 4 million small businesses would be eligible. Well, only 200 and some have actually taken advantage of the small business tax credit. Small businesses said, we're not expanding, we're not hiring new people, and others are saying we're not creating business, just entirely because of the Patient Protection Affordable Care Act. We're also, of course, seeing the new, starting next year, 2013, this new 2.3% tax on medical device companies. We've seen companies like Stryker in Michigan saying that starting at the end of this year, they're going to reduce their workforce by 5% because of the Affordable Care Act. We're seeing really a major reduction in venture capital for medical device companies, biologic companies. Research and development will be destroyed in this country, and America is where most of the R&D comes from, because we do have the opportunity for businesses to succeed. We don't have the price controls. But with these new taxes and the new taxes on drug companies, on insurance companies that come into being next year, this is going to destroy the healthcare industry. And as you said a minute ago, I think this is really going to lead us down the path to a single-payer Medicare for All program. Private insurers will be crowded out of the market. When you look at the component of the essential benefit plan, what an insurance company is going to have to include in one of these state-based exchanges, the medical loss ratios, where they're going to have to spend 80 or 85% of the premiums they collect on claims, and only 15 or 20%, depending on size, on administrative parts of their business. This is really, these are ways to destroy the private insurance market, and government will be making decisions about what kind of tests we get, what kind of procedures we get, and how we get our health care.
And that's exactly what's going to happen. We're having a conversation with the president of Pacific Research Institute, Sally Pipes.
Sally, this is Clay, and I was in Sacramento this past week, and I was in a meeting with Peter, who's going to be running the exchange, the California Exchange.
Oh, right, Peter Lee.
Yes. Peter Lee also ran the failed previous plan we had in California. And my question always is, well, how many times does government have to fail before we let the private sector become successful? But one of the things that came up was there's a $2,000 fine for employers that don't offer benefits, and there's a $3,000 fine to an employer who has an employee that goes from their group plan to the exchange.
Right.
Do you know, can you expand on those items a little bit?
Sure, yeah.
Go ahead.
So under Obamacare, the employer mandate is a very important part. About 160 million Americans, out of about 310 million, get their health care through their employer. Employers, of course, were given the opportunity during World War II when wage and price controls were in to write off the cost of providing health care. So employees get their health care with free tax dollars. If you lose your job because insurance isn't portable, you go into the individual market. You have to buy your insurance with after-tax dollars. And I think that's one of the reasons, that the individual market has not been as buoyant as it should be. But under the Affordable Care Act, if you have 50 or more employees and you do not provide insurance or you take away insurance, an employer will pay a $2,000 per employee fine to the federal government so that they can get their insurance in these state-based exchanges, which would be up and running according to the legislation in 2014. A few states have turned the money back. A few states, Texas and Florida, said they're not going to set up an exchange. Of course, Kathleen Sebelius, Secretary of Health and Human Services, has said, well, if you don't set it up, I'm going to set it up for you. So it's all very frightening. But I think, according to the Congressional Budget Office, came out with a new study a couple of weeks ago saying that they think up to 20 million Americans will lose their employer-based insurance because of this employer mandate. A lot of employers are going to say, why should we spend $15,000 per year on a family plan for an employee when we can put $2,000 towards the people buying their own insurance in the state-based exchange? Remember, the president said over and over again, if you like your health insurance and you like your doctor, nothing is going to change. Well, it is changing, and I think people are realizing it, and the CBO has admitted it. McKinsey, the consulting firm, they had said last year they predict about one-third of those 160 million Americans are going to lose their employer-based coverage because of Obamacare. There's also, if you provided insurance to your employees and you decide to take it away, then you would pay a $3,000 per employee fine. But still, for employers, that is relatively cheap compared to the $15,000 they're paying right now. Of course, if an employer provides your insurance, you may pay a small copay, you may pay part of the premium, but of course, and your salary is slightly lower because employers are paying. But I think a lot of employers are going to say, this is a much better deal for us. And the American people are going to say, I thought we were told if we liked our insurance and we liked our doctor, nothing will change. Well, it's an eye-opener because a lot is going to change unless this legislation is repealed and replaced.
Sally, we're going to come to a close here in a second, but Marty and I both agree we'd like to have you back for a full hour, maybe on a regular basis as we continue to move towards the Supreme Court situation.
Sure.
But one of the things I learned from Peter Lee yesterday when I was this past week when I was in Sacramento is that even if Obamacare is overturned, California is going to move forward with their single-payer program.
Well, exactly. I mean, Peter Lee has said that it's irrelevant. They're going to move forward. California, of course, was one of the first states to take the money from the federal government to set up the exchange. And here we are, April 2012, and no exchange is being set up. What are they doing with the money? I think there's going to be an initiative on the ballot in California this fall, which will be another single-payer initiative. Back in 1994, around the time of Hillary Care, there was a single-payer initiative on the ballot. It was defeated by the largest percentage at the time. When the people of California realized what single-payer meant to them, they rejected it. But
Sally,
you keep trying and trying, and eventually these things, go through.
Yeah. Sally, we're going to have to, in fact, if you could hold on after we're done, we want to talk to you. But we'll be back in 167 hours, and thank you, Sally, for being with us. We'll be back on Taking Care of Business on Current Radio, News Talk, 1180.